Well, good morning. Today I want to talk about a very difficult subject for a lot of ladies to talk about, and that's vaginal rejuvenation. Now, that term carries a lot of uh, implications. It also carries a lot of different meanings depending on who you're talking with. So today we're going to just try to drill down on that and help everyone understand what we're talking about with vaginal rejuvenation. The most common um, problem with vaginal atrophy is that women have a lot of discomfort with intercourse. They have vaginal dryness. They just don't feel right, and that usually comes from a lack of estrogen that occurs with menopause. There are other causes as well, but menopause is the biggest culprit of this problem. And what happens during menopause is that the lack of estrogen causes the mucosa of the vagina, the lining of the vagina, to start to change so that it's thin. It won't lubricate as well as it normally would. It's not as elastic as it normally would be. This also occurs to the outside, right around the opening of the vagina, the area called the vulva. And so therefore it's very important for us to address this with patients, because just because you hit menopause doesn't mean that you have to give up enjoying intimate relationships any longer. Estrogen replacement, both in creams as well as other forms, and at another talk we'll talk about this in a lot more detail, can restore the vagina and give that estrogen back. Now, yes, a lot of ladies complain that the creams are quite messy and that the placing the tablets and all in the vagina is kind of an aggravation. But that is an option that we have for treating vaginal atrophy. Another option, and one that has really hit a lot of home runs for a lot of ladies, is the rejuvenation of the vagina using the Mona Lisa Touch, which is a laser treatment to the vagina that stimulates the fibroblasts, the collagen production in the vagina to help thicken the vaginal mucosa. It improves lubrication, pliability, and relieves most, if not all, of the discomfort associated with intercourse when it's associated with vaginal atrophy. Now, this has really been important in women with certain types of cancer, especially breast cancer, because they're taking medications that reduce or get rid of all the estrogen so that there's no recurrence of their breast cancer. But this has a very dramatic effect on the vagina, and it's very difficult for women to enjoy their relationships with their spouse or significant other because it is so painful and uncomfortable. And we have really found that this has helped so many women that they are able now to resume a normal life, even though they are dealing with breast cancer and the consequences thereof. And so this has really, from a physician standpoint, has been very rewarding because now we have something to offer patients that will help them with their discomfort with intercourse and their vaginal lubrication. They don't have to use lubricants all the time. They don't have to use messy creams, so that's very helpful. Radio frequency treatment to this area is also another option that's available to help do the same thing, stimulate the fibroblast and collagen production, and aid in the health of the vagina. But menopause is not the only place where you may have difficulty with lack of estrogen. A lot of younger women who are breastfeeding have noticed that they have the same type of symptoms. And that's because the breastfeeding does tend to reduce their estrogen levels in the vagina, and therefore they don't lubricate as well. It's more uncomfortable having intercourse. So this will help them as well in treating that problem until they have finished having their families, and then most of the time everything will come back pretty much to normal until menopause comes around. Now, there are other options available to women depending on the problems that they're having. This may involve tightening the tissues in the vagina to relieve symptoms of prolapse or minor prolapse. There's also treatments to help improve the external area of the vulva that cause women a lot of discomfort and at the opening. I've actually had women who are not sexually active say, I finally feel normal again. And I think this is very, very important. Let's look here to see if...
We've got 2 or 3 people watching. They're coming on and off.
Okay.
But
well,
this is one of those topics I don't know if people want to ask questions.
Yeah, and yet this is a difficult topic to talk about. Even when I ask women, are you having these problems? So often I get, well, nothing more than usual. And I think a lot of times folks just think, hey, this is something that I just have to live with. This is just part of life and something that I have to live with. And you don't. You don't really have to just live with it. There are things that we now have to help you with those problems. Let's see, Mary, yes, the answer to your question, do you have to have a referral to be seen in the office? No, you do not. That's not a requirement. And do you have to change doctors? No, we don't require you to change doctors and not see your regular doctor anymore. We can certainly treat that problem, and you can go right on seeing your primary care physician or other OB that you normally would be seeing. We just help you get back to being normal again. So there are lots of things that we have to offer, and we're more than happy to do that for women who need these services and restore themselves to the type of lifestyle that they would like to have. It's kind of funny. You get the kids out of the house and you've got everything so that you can just really sit back and enjoy your spouse or your significant other, and now you start having trouble with painful intercourse. And you don't have to worry about the children anymore. Now you've got to worry about the fact that it hurts. And it's hard to become sexually aroused when you know what you're getting ready to do is going to be painful. And I think there are a lot of spouses that are very sensitive to this, and they don't want to hurt their wives. Some don't seem to catch on very good. And I think that's something that's real important for us to consider because once we get this corrected, life seems to be getting back to normal. Speaking of getting back to normal, gee whiz, aren't we glad the mini monsoon is over? It's so nice to see the sun out today and everything's looking real nice. Yesterday was a beautiful day. Yes, we need the rain to wash all the pollen off and everything else, but we certainly are glad to see the sunshine back out, and hopefully as things start to warm back up, it'll be very enjoyable outside. And now we have an extra hour of sunlight in the evening so that we can get some of those chores done that we'd like to outside because it stays light for a longer period of time. So, ladies, it's a difficult subject to talk about, but it's real important that you don't hesitate to bring these things up to your physician or to us. If you want to come in here and say, hey, I'm having that problem myself and I'd like to get something done. It is a difficult subject to talk about, but it is a subject that we can certainly do a lot for you and help you in many, many ways. So I don't believe there are any other questions. So we're getting ready to sign off and to say I hope you all have a great week. And again, if you need, just give us a call, set up a time, come in. We can talk about those problems and see which modality would work best for you. Thank you and have a great day.